The opinions expressed by ResusLogix or Dr. Montano do not necessarily reflect the views or positions of his employer, past or present.
Let's talk about trauma care. You know, those high-stakes, life-or-death moments where every second counts. For years, the rules seemed set in stone. But what if I told you that right now, medics are being forced to unlearn some of the most fundamental things they were ever taught? Because new science is literally rewriting the book on how to save a life. We've all heard this, right? It's the mantra of every emergency responder. In trauma, the clock is your biggest enemy. But it's always been a bit of an abstract idea. Well, not anymore. We can now put a very real, very scary number on what every single minute is worth. 11%. That's how much a patient's risk of dying goes up for every single minute they're delayed from getting blood. Let that sink in. Not every 10 minutes, every single minute. It's an absolutely staggering number, and it's the driving force behind all the changes we're about to dive into. So when you arrive on a chaotic scene, where do you even start? For decades, the answer was always the same. But the biggest shakeup in modern trauma care starts with flipping the old playbook on its head. Okay, so for years, every medic on the planet was drilled on ABC: airway, breathing, circulation, in that order. But now the new gold standard is XABC. That X stands for exsanguinating hemorrhage, which is just a fancy term for catastrophic, life-threatening bleeding. The new logic is brutally simple. What good is opening an airway if all the blood is pouring out onto the ground? You have to stop the massive bleed first. Everything else can wait. And if you want to know why this one little change matters so much, just look at these numbers. A 2024 analysis showed that when medics used the new XABC approach, tackling that major bleed first, the mortality rate was just 13%. But with the old ABC method, it was 47%. That is a huge difference. We're talking about saving so many more lives just by reordering the first step. All right, so rule number 1 is now stop the bleed. But the revolution doesn't stop there. Next up, we're going to look at 2 of the most iconic procedures in all of emergency medicine, IV fluids and CPR, and why we're having to seriously rethink both of them. So the old thinking was pretty straightforward. If a patient is losing blood, pump them full of saline to keep their blood pressure up. Makes sense, right? Well, a massive 15-year study of over 150,000 patients found the exact opposite. What's so wild is that as medics started using less IV fluid over time, patient outcomes actually got better. Their blood clotted more effectively and mortality rates dropped. Sometimes less really is more. This feels like a trick question, doesn't it? I mean, come on, somebody's heart stops, you do CPR. It's the one thing everybody knows. But what if the reason their heart stopped is because they've bled out? Turns out, in that specific terrible situation, our go-to move might not be the right one. And here is why. In a patient with severe hemorrhagic shock, the problem isn't that the pump is broken, it's that the pump is empty. There's just not enough blood left to circulate. And what a recent study found is that doing chest compressions in this scenario doesn't really help get oxygen where it needs to go, and it might even make things worse by disrupting the little blood flow that's left. Okay, so if we're doing less of some of the old stuff, what are we doing more of? Well, this is where it gets really interesting. The focus now is all about using smarter, more targeted tools and getting them to the patient as fast as humanly possible. This right here is the game changer. It's the ultimate answer to that stop the bleed problem. Because you're not just plugging the leak, you are actively replacing what's been lost, right there on scene. Remember that 11% statistic? Giving blood in the field is how you stop that terrifying clock. Now, along with giving blood, medics have another incredible tool in their kit, TXA. You can think of it as a super booster for your body's own natural clotting ability. It's a drug that helps make the clots that are forming at the injury stronger, preventing them from breaking down. It basically helps the body save itself. And the proof for TXA is just rock solid. Major studies with over 1,700 patients found a clear survival benefit. People who got it needed fewer blood transfusions later. And, this is the really important part, it didn't cause an increase in other complications. So it works, and it's safe. It's a total win-win. And finally, let's not forget about pain. For ages, morphine was the go-to. But recent research shows that ketamine is just as good, if not better, for severe pain in a trauma setting. It gives powerful relief without some of the risky side effects of opioids, making it a much safer choice for medics out in the field. For our final section, we're tackling an icon. Seriously, if you picture a trauma patient, you probably picture them in one of these, the cervical collar or C-collar. For decades, it was slapped on pretty much everyone just in case. But that practice is changing, and fast. It turns out that thing we thought was a harmless precaution, well, it isn't so harmless after all. There's a whole list of problems they can cause. C-collars can make it harder to manage a patient's airway, they increase the risk of choking, and they can even raise the pressure inside a patient's skull. They can also hide injuries on the neck and just make the patient more agitated and scared. That's a lot of potential harm for a questionable benefit. And here's the real kicker. When the Cochrane Review, one of the most respected groups in evidence-based medicine, went looking for the high-quality studies that proved routine C-collars work, they came up empty. They just couldn't find any solid proof. The entire practice was built more on tradition than on science. And that's why you're seeing them used far, far less. So from the ABCs to C-collars, the very foundations of how we treat trauma are being shaken up. It's just such a powerful reminder that science is never finished. It's all about questioning what we think we know and being brave enough to change course when the evidence points a new way. It really makes you wonder, what medical fact that we take for granted today will be completely overturned tomorrow?